International Patient Safety Goal.
Identify patients correctly.
It is true that doctors or medical practitioners play an important role in the healthcare industry by treating the patients in the right way. But at the same time, you cannot deny the role that nurses care industry. In fact, they are the unsung heroes who take care of the patients day and night without being impatient or irritated. That's why it is crucial for us nurses to get to know our patients correctly. Identifying patients accurately and matching the patient's identity with the correct treatment or service is a critical factor of patient safety. Getting to know more about your patient means you care.
So how would you identify your patient correctly? Active patient identification.
Identifying a competent adult patient by asking her to tell the staff her full name, while staff ensures it matches the information to identifiers. By using for complete names of the patient for Saudi and 3 names for non-Saudi, an ID number a common number. Identification bands.
Adult and pediatric white ID band. Neonates ID. Blue ID bands for boys. Pink ID bands for girls. White ID band for ambiguous
ID numbers.
NV new visitor, NB newborn, NG new orphans new staff.
Identification of unknown or comatose patient.
Mr. X provide a temporary ID number. Check with 2 nurse or 2 relatives.
Mass casualties.
Casualties. The unknown or comatose patients are given alphabetical letter taken from relatives or official authorities together with copy of their government ID, IQAMA or passport, thumbprint to be taken on admission paper with signature admission clerk.
Identification of dead body.
ID band is on right wrist and ankle patient's name, ID, gender. Adhesive plaster is posted in the chest with name, ID number.
Special consideration.
If in case of burnt or amputated attached to the patient clothing where it is clearly visible or to the patient's skin with transparent adhesive tape. Change ID band if soiled or damaged.
When you will identify the patient?
When giving medications, blood transfusion, all therapeutic procedures, endorsement, diagnostic, addressograph for all forms. Getting to know your patients means you care.